Do you struggle with pelvic complaints? And by pelvic complaints, I mean complaints that originate in the lower portion of your spine, often either on the left or the right hand side, and also into your gluteal muscles. If you do, and you're an office worker, there's every chance that something that you're doing over the course of a work day can be contributing to this pelvic complaint. Now, the pelvic complaint you might never experience whilst you're sitting at your desk. You might notice it when you roll over in bed at night. You might notice it when you get out of a car. You might notice it when you exercise. Pain and discomfort through this area that occurs outside of the office can absolutely be caused by something that you're doing inside of the office. At ERGO Collective, we believe that most people's body complaints come from their poor, static postures. And where do you do most of those? At work, of course. It's really important to consider the ergonomic, the behavioural, and the postural things that you do every single work day and how these contributing elements can cause pelvic issues. Let's have a little bit more of a chat about the anatomy of your pelvis and talk to you about how it's designed to work and offer you some suggestions about some of the things that can contribute to that in a workplace. All right, let's talk about the pelvis and how it's designed to work and how behaviors and postures that you adopt inside of the office can lead to pelvic issues outside of the office. What you've got to think about is when we talk about your pelvis is we're talking about your sacroiliac joints and that's where your two dimples are at the base of your spine. Underneath both of those dimples are your sacroiliac joints. You've got one on the left and one on the right. We're talking about your pubic symphysis, which is the joint right at the front, and we're talking about your sacrum and your coccyx. So when we talk about pelvic complaints, they're the areas that we are talking about in terms of vulnerability. What you've got to understand about your pelvis is it's essentially a bowl. And what happens is you've got your joint at the front being your pubis and the two sacroiliac joints. And when we sit with good posture, what should happen is the bowl should be reasonably stable and round. Good posture when you sit should be your ears falling over your shoulders, which should fall over your hips. And you should be sitting nice and square and straight through that pelvic area, and the body weight of your torso should punch out evenly through your pelvis and straight into the seat. If you're sitting up on your ischial tubes and in this nice stable position, the pelvis is really happy and there's not that much loading that goes through your sacroiliac joints or your pubic joint at the front. However, where you run into trouble is when we start to put a torsional strain through your pelvis. It might be that you cross your legs. It might be that you sit on your leg. The pubic symphysis joint at the front is really stable and it's very unlikely that that's going to have problems. Where you will end up with problems is through your sacroiliac joints and your sacrum at the back. Because what you're doing is when you sit on your leg, you're putting a huge amount of torsional strain through your pelvis. And it will do it and it will accommodate it, but it's not how it's designed to work. And what happens is the body really freaks out when your pelvis is in such an unstable position. And what happens is it recruits muscles to try and correct that poor loading through your sacrum. The muscles that cop it are your piriformis muscles and your gluteal muscles. What you've got to understand about these muscles is that they're sprint muscles. They're strong and they're powerful and they consume heaps of energy, but they're not designed to be used for excessive periods of time. When we walk, when we squat, when we pick something up, those muscles are great because they're used, but then they get to relax again. And this is what they fundamentally are designed to do. On, off, on, off. This is what the gluteal muscles want to do. However, when we adopt these poor postures like leg crossing or sitting on our leg, what you actually are doing is you have to recruit those muscles for a long period of time because they're the only things that are creating stability within your pelvis. And this is great for your pelvis, but it's not great for these muscles because ultimately you're over recruiting them. And essentially you're using these sprint muscles to do an ultramarathon over the course of a work day. When we sit and we sit well, our pelvic floor is also engaged. Your pelvic floor is not dissimilar to your core or your rotator cuff muscles in that they're your endurance muscles. So when we sit and our bowl is nice and round and stable and there's no torsional loading going through the sacrum at all, the pelvic floor is engaged and it provides that stability. But as soon as you create some torsional strain patterns through your pelvis, what you end up doing is switching off that pelvic floor because it's not strong enough to balance that poor loading. And then again, your gluteal muscles switch on. Fundamentally, when you sit in terms of pelvic complaints, it's really important that you are balanced both left to right and front to back. Putting excessive torsional strains through our body causes pelvic complaints every day of the week. Let's have a little bit of a chat about some ergonomic, some postural, and some behavioural considerations of what you do whilst you're sitting at the desk, which can contribute to the pelvic complaint that you have. An ergonomic consideration in terms of pelvic complaints is when our computer monitor screens are not squared directly in front of us. When you have more than one monitor, it's still really important that they're directed in front of you. When you have a monitor off and say a 45-degree angle, what it does is it draws our attention too far away from our midline. So when you do use this monitor, you tend to shift your body weight toward it. As you could appreciate, by doing that, you're all of a sudden shifting the gravitational load within your pelvis. And instead of it going squarely through your sacroiliac joints, all of your weight is now shifting into one of your hips and buttocks. This creates that rotational torsion through that pelvis, which leads to sacroiliac joint or pelvic complaints. Similar to your monitors not being square, positioning things too far away from you that you reference regularly can lead to pelvic complaints. Make sure that when you're sitting at your desk, whether it's a phone, whether it's a printer, whether it's documentation, that they're positioned nice and close in to you so that you do not have to reach for it. Another ergonomic consideration in terms of pelvic complaints is checking that your chair depth is appropriate for your build. Most office chairs are made for the standard measure. However, if you're either very tall or very short, this standard measure is not suitable for your build. Often we see patients with pelvic complaints are often of shorter height and they're sitting on a seat that's far too big for them. Why this is problematic is if the seat is too big for your thighs, you can't sit all the way back in the chair without the seat hitting the back of your knees. That sort of pressure on the back of your knees is uncomfortable, so what you adopt to accommodate this is a perched posture. Perching is really bad for your pelvis and it causes lots of pelvic, hip and gluteal issues. If you do struggle with pelvic issues and you are of a shorter height, please review the chair depth and make sure that's appropriate for your build. A perching posture is a really big cause of sacroiliac joint or pelvic complaints. As you can see from this positioning, I'm sitting on the front edge of my chair, my shoulders are forward of my hips and my body weight is shifting forward. This is a really unstable position to sit in for the long period of time. It's really important that when you do sit, it's important that you put your bum right back in the chair and have your entire back on the backrest. This perching posture can lead to all sorts of pelvic complaints. One of the most common postures for pelvic complaints is sitting with your legs crossed. As a general rule of thumb, within your body when you sit at the desk, you should have balance between your left and your right. What tends to happen is when we cross our legs is we put a huge amount of torsional strain through our pelvis. We were talking before about how the pelvis likes to be balanced and square. You can imagine as you pull that leg way across the other side of your body, it can put huge amounts of strain through your sacroiliac joints. If you do suffer from pelvic complaints, it's really important that you sit and you have a nice square pelvis over the course of the day. Sitting on your leg is one of the worst postures that you can adopt for your sacroiliac joint in your pelvis. What you do is when you sit on your leg, you put a huge amount of torsional strain through that pelvis, which will irritate the sacroiliac joints. Interestingly, People who sit on their legs are often of shorter height because as a kid, what they realize is if they sit on their leg, it gives them a little bit of a height increase. If you are a little bit short and you do sit on your leg and you struggle with pelvic or sacroiliac joint pain, I would encourage you to review your sitting posture, and you might find that the pain that you experience through that posture will go. The side shift posture is another classic cause of pelvic pain and discomfort. Similarly to the monitor heights and the desk positional advice, as soon as our body shifts off center, we put a huge amount of stress and strain through just one side of our pelvis, and this can lead to sacroiliac joint and pelvic complaints. So always make sure that your load distribution is reasonably balanced from left to right, and you can achieve this simply by making sure that you're always sitting with your chest up. A behavioural consideration in terms of pelvic complaints is again this perching posture. This is relevant in terms of people who tend to get up and down a lot over the course of the day. Often what happens is if you do get up and down a lot over the course of the day, what happens is when we come back to our desk, we never quite set ourselves up perfectly because we have this anticipation that we're then going to have to get up quickly and go do something else. What often happens is we get distracted with an email or distracted with the project, and for what we thought was going to be only perching on the chair for a moment to do a simple task, then turns into be a 2 or 3 hour task, and we're propped up in this perching position for a prolonged period of time. So if you do get up and down a lot over the course of the day, it's really important that you set yourself every time you come back to your desk, making sure that your bum's right back in the chair and that your back is on the backrest. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you, whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is booking for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At ERGO Collective, we're your partners in office health.